Right now, we're down to about 12.6, or in 2010, we were down to 12.6% of high school students smoke. In Broome County, it's right about the same level. And the national high school smoking rate is 19.5, so you can see New York is quite a bit lower. So these different, we use evidence-based strategies, things that have been shown through research to be effective, and that's why we see progress.
And how do you help establish smokers with the quitting programs?
Right. When we have established smokers who would like to quit, we have an excellent quit line, the New York State Smokers Quit Line. And people can call that because research has shown that if a person wants to quit, they'll be most effectively able to quit if they use a combination of the nicotine replacement medication or Chantix, which is a little different, and coaching. And so the Quit Line provides free coaching over the phone, and they also, if you're medically eligible, can provide the patch for free for 2 weeks to get you started in that quit attempt.
That's great. And maybe now we'll kind of switch gears and go to Sarah. All of a sudden you are beginning to hear a lot more about the problems with lead and how it's especially affecting young children and everything. So can you kind of tell us what do you do at the health department in reference to that?
Sure. Well, I'm both a public health educator, but I'm also a program coordinator. So not only do I make sure that some of our programs run, but I also do a combination of housing inspections. I'm a lead-based paint inspector and risk assessor, certified by the EPA. And we also do a combination of outreach and education and also enforcement of public health laws.
Now I guess, I think for, not only myself, but a lot of people, everybody thought the whole thing about lead had gone away, but it hasn't. So there's a whole program, so it's...
Yeah, we actually have 3 different programs, believe it or not. Lead is more of a problem than most people realize. A lot of people think, well, hey, lead was banned for residential use in 1978. Nobody uses lead paint anymore. It's not a problem. Why do we have to worry about it? Well, the problem isn't with the layers of paint that we're putting on top of the old layers. It's the old layers of paint underneath. And if the old layers are not properly maintained, as soon as they become deteriorated, they can turn into chips and dust, and they can be available for ingestion or potentially inhalation, which causes lead poisoning.
But what can it do to us? I mean, I know you're saying the chips and stuff. It
can, while it can harm adults, usually the greatest risk for adults is if they're working with lead. So if, it was a contractor who is scraping paint or sanding paint, it's possible they could be lead poisoned. However, the largest concern is with young children and pregnant women. Young children are developing very rapidly. They absorb everything like a sponge, whether it's information or nutrients. Unfortunately, lead gets in the way of that, and it harms normal childhood development, and it causes everything from neurological problems to kidney problems. I mean, there's really a lot of things that it affects. And the effects are permanent.
And why can't parents just keep their kids away from it? I think I know the answer.
It sounds simple. Unfortunately, it's not as simple. People usually say, oh, well, I don't let my kids eat paint chips. Or, they think it's about just kids eating paint chips or chewing on windowsills. And while that does happen sometimes, lead tends to have a sweet taste to it. So there are some cases, and I have seen them, where, children do tend to eat paint. However, that is not the norm. Usually, the lead that's from deteriorating paint creates a very fine dust, and that dust can be invisible, like microscopic. So when it gets on children's hands, all it takes is a young child, 1, 2 years old, crawling around on the floor and then putting their hands in their mouth. I mean, all children suck on their fingers, So it's very common.
So what can we do to... That's a big one.
Yeah, I know it's a big one, but there's lots of things. Again, since young children are the biggest concern, and usually when a child is exposed to lead, or if they're lead poisoned, you generally can't see any outward symptoms unless they're very severely lead poisoned. So one of the most important things to do is have your child tested for lead. New York State public health law requires that all children are tested for lead at age 1 and then again at age 2. If you're not sure if your child has been tested for lead, you should ask your doctor and make sure they have been tested. Say, for example, you have a child that is 3 years old and you live in an older home. If you're not sure if they've been tested, 3 years old, you can get them tested now, because you never know. We've had cases, I can think of one particular case. We had a child who was tested for lead when he was 1, and his lead level was low. He wasn't tested again until age 3, and then his lead level was 58. 10 is lead poisoned. So, I mean, there's a huge jump there. We could have caught it so much earlier and had far fewer problems down the road.
What's lead paint safety?
Lead paint safety. Well, this is kind of a big thing, and I don't know, I think you said you had heard something about this before.
Right.
In April 22nd, 2010, there was a new law that was put into place. So anyone who disturbs paint in older housing, which is pre-1978,
right.
if they're receiving compensation for the work that they're doing, so either if they're a contractor or if they own a home that they're renting out to someone else and they're receiving rent, that counts as compensation. They are required by the EPA to be lead certified, so that it's a one-day training they have to take, and then the firm or the company they're working for also has to have a certification. And in that class that they're required to take, they teach all about lead safe work practices, and they also teach about some of the laws that are in place. But the basic tenets of lead safe work practices, the general idea is to minimize the amount of dust that you create whenever you're doing the work. So using wet methods, just trying to keep the dust to a minimum, containing any dust that you do create by using plastic and containment measures and things like that, so that fine dust doesn't get all over the place, and then cleaning up very thoroughly whenever you're done. So using wet methods, using a sealed HEPA vacuum, which is different than just putting a HEPA filter on a shop vac. It's very different. But using those things really helps minimize it. There's also certain things that are not allowed that folks should definitely be aware of, even if you're doing work in your own home and not being compensated for it. Dry power sanding is a big no-no because it takes all those fine lead particles and throws them everywhere. It's certainly possible to be lead poisoned that way. Same thing with open flame torching and burning of paint that can vaporize the lead particles and cause you to inhale them, and that's not a good situation either. So.
Okay. Now, what can we do to protect our kids?
Well, luckily there's a lot of things that parents can do. Even if the paint in the home isn't in the best shape, it is still possible to control some of those hazards just by the things that you do every day. Most importantly, again, I want to reiterate, make sure your children are tested, because the only way to know for sure if they've been exposed to lead already is to have them tested. So that's really important. Next, you can also, hand washing is a really big thing, especially for the little ones. Washing toys frequently, anything that typically goes in the mouth of a young child, it's important to wash. And hand sanitizer doesn't work. Lead isn't alive like a germ is. You have to have the action of the water taking the lead off of the hands, so that's a really important point too. And also, any surfaces that may have lead dust on them. I know windows are a big one, and actually I can show a little demonstration in a moment.
This lovely
in a moment I can show some of the places where we typically find lead hazards, but using wet cleaning methods to reduce the amount of dust that's on those surfaces, wiping down your window sills every couple of weeks, also cleaning out the window troughs inside the windows, and I'll show you where those are, using mopping on the floors instead of dry sweeping, that sort of stuff, anything to minimize dust.
Maybe if you could kind of show us a little bit about the house here.
All right. So like I said, any home that was built pre-1978 may have some lead in it, and the older a home is, the more likely it is to have lead. This is obviously an old Victorian style home here. Some of the areas that I was talking about, here's an older window, it's an old double hung window. Some of the places where we find the worst lead hazards are inside the window, down in the window well. That's the part in between the storm window and the double hung window. Usually, and if you have an older house and the windows haven't been well maintained, you'll getting my words mixed. You'll often see paint chips and dust inside the window well. Also, since the window here moves up and down, the window tracks on the side, that is a friction surface. That's a surface where there's two pieces of wood that are rubbing together that are both painted, and oftentimes that will also create lead dust that falls inside the window and inside the windowsill. Also on the outside of a house, you'll get chipping and peeling on the outside of the trim. You can also get it on the siding, and sometimes that can end up inside the home. Also, another place that we very typically see lead paint hazards are the friction surfaces on porches. Lead was the good stuff, and they often used it on exteriors in places that got a lot of abuse and a lot of wear and tear. So the walking surfaces on a porch, a lot of times those floors were painted with lead, and walking back and forth over them causes the paint to deteriorate and causes the lead dust to be tracked inside. Hopefully that was helpful.
Yes. Why the focus on babies and toddlers?
Well, part of it is young children, they're so small, and not only are they growing rapidly and absorbing a lot, but their bodies are also really tiny. So even a small amount of lead can really make a big problem. And the issue with lead is that it gets in the way of normal childhood development. So the brain just doesn't develop the way that it should because lead is a neurotoxin. Yep. And that's the biggest part of it.
And so what can the health department do?
Well, we have a few different things that we have available at the health department. We actually have 3 different programs. The first one, our childhood lead poisoning prevention program. It's been in place for at least 20 years, I would say. It's a secondary program. So because children are required by New York State to be tested at age 1 and then again at age 2, if a child comes up with a high blood lead level, we find out about it. So then we have to follow up with the family, do an environmental investigation of the home, see where the lead is coming from, and do what we can to make sure that child has a lead-safe environment, and to make sure those levels come down as quickly as possible. So that's the first program. Then we also have a second program called the Lead Primary Prevention Program. So the point of that program is to try and find places where children may be exposed to lead hazards and take care of the problem before they're actually poisoned. This is extremely important because some of the damage is done even at those lower levels. Like, it's really important to get this before it happens. So the Primary Prevention Program does a combination of outreach and education. We get referrals for inspections from a lot of different places. We can do free inspections. So if anyone has concerns, if they're living in an older house, if they're renting and they see chipping and peeling paint and they have young children, they can always call the health department and we can check it out. So that's a big part of what we do. And we also do enforcement of the public health laws. Conditions conducive to lead poisoning, or having a home where young children are being exposed to lead are not legal. So that's something that we follow up on and do enforcement and make sure the problems are corrected. And we do have some resources that we can help out with that. And I wanted briefly to mention, we do have some of the resources. We have a HEPA vacuum loaner program, and this is something that's available to anyone. I don't know, this is a little small, but this is through Cornell Cooperative Extension. If anyone is interested in it, they can call Cornell Cooperative, but they can borrow a very high quality HEPA vacuum cleaner. It's got the right kind of filter in it. It filters out those very fine particles. It's really good for allergens too. They can borrow it for free for 3 days. So they just have to call Cornell Cooperative Extension and sign up. We also have some free painting supplies that we can provide through that program. So depending on the situation, and anyone can always call the health department for more information, we can provide free primer, plastic paintbrushes, that sort of thing to get the work done, and training as well. So then the third program, there's a brand new program, and we're really excited about this, is our HUD Lead Hazard Control Program. And that's, if you have any, if you're interested, contact the First Ward Action Council. There's actually funding available to get work done in your home. So we're really excited about that. I
appreciate both Sharon and Sarah coming today. I think we have educated people a little bit more about what's going on in Broome County. And it sounds like both of you are very busy trying to get the word out, and that's a great thing. So on behalf of Broome County Council of Churches, thank you for watching Encounter today.